Hi, I'm Mizzy. I'm the nurse practitioner here at Atomic Beauty, and I'm with Dr. Nguyen, and we are about to draw blood for PRP. So we're going to do PRP hair restoration today.
We always want to make sure before you have your blood drawn that you're well hydrated that day, and also that you've eaten before you come for the procedure. But ideally also the day before, we'd love for you to have drinking like 2 liters of water and like a vegetarian diet will give us a really good sample for that blood draw on the day of your treatment. All right, Mizzy's done a phenomenal job of taking my blood. What we're gonna do next is we're gonna put it in the autoclave and we're gonna spin it down, and it's gonna separate the different components to the blood. So we're gonna separate the platelet-rich plasma from like the red blood cells and the white blood cells. So then you're gonna see the finished product here in a few minutes.
Okay, so we're about to put the blood in the centrifuge. This is called a centrifuge, and that's what spins down the blood, and you have to balance it with the same amount of water. So put that right across here, and we'll close it. And everything's preset and we're ready to go. It'll spin for 10 minutes.
So we have spun down my blood. So what sinks to the bottom is the red blood cells and the white blood cells. We don't want to be injecting that because those are inflammatory. But the good stuff is the PRP, which is the platelet-rich plasma. I call that the liquid gold because we're going to be injecting that into my scalp. Why PRP is important is it actually stimulates the growth factors. And so we're going to be increasing blood supply to the hair follicles, strengthening up that hair shaft. So I have denser, thicker hair is going to be the end goal. Ideal candidates for this procedure are those in the early stages of hair loss where those hair follicles are still functioning, but good for both males and females.
All right, guys, so we've spun down the blood and we've drawn it up. It's all ready to go. And so Dr. Nguyen, the main area that bothers her is through her scalp here. So you can kind of see that she does have a little bit of hair loss through here. It's a little thicker throughout here, but we'll put some kind of all over. And then another spot is through here. You can kind of see that she has a little bit of hair loss through here and right here. So it's very common to lose hair, especially wherever you part, you'll tend to see more hair loss. So we're gonna go ahead and get her cleaned up with alcohol.
I think PRP is amazing for hair restoration because it's very natural. It's a 3-step process. So step 1 is we take a small sample of your blood. Step 2, we spin it down and we process that blood and we draw out the platelet-rich plasma. And then step 3 is simply we inject it back into the scalp or other areas where you might be thinning.
So what PRP does is it basically stimulates growth factors, and what growth factors do is it's gonna help increase circulation and increase blood supply to the area. And what that does is it's gonna strengthen the hair that's already there and help new hair growth. I'm massaging the scalp, all the areas that we injected, just to get that PRP kind of moving in there and spread out.
What's nice about it is it's non-invasive, and so we don't need to be doing surgery to restore hair loss. There's no downtime, there's very minimal discomfort. You can go back to your normal activities immediately thereafter. What's also nice is results on average last for about a year, and so ideal results are seen at month 4 to 6, and then we have you come in for a maintenance treatment like once a year, because certainly it's not a permanent solution for hair loss. There's very minimal discomfort, and what to expect afterwards, you might have a little bit of swelling and tenderness, maybe redness for the first 48 hours, and then it resolves.